The candlelit atmosphere of Romano's restaurant buzzed with excitement as my family gathered around the large circular table, champagne glasses raised in honor of my sister Claire's engagement announcement. The private dining room echoed with congratulations and wedding talk while I sat quietly in the corner chair, trying to ignore the throbbing pain from yesterday's chemotherapy port access. "To Claire and Jonathan," my father boomed, his voice carrying across the restaurant. "Finally, some wonderful news to celebrate instead of constant drama." The pointed comment landed exactly where he intended. For the past 6 months, my family had been treating my cancer diagnosis as an elaborate attention-seeking scheme designed to steal focus from Claire's relationship milestones. "I'm just so relieved we can focus on positive things," my mother declared, dabbing at happy tears. "After dealing with Rebecca's health anxieties for months, it's refreshing to celebrate actual achievements." My Aunt Patricia nodded vigorously. Claire's engagement is what this family needed. Real joy instead of manufactured medical crises. I shifted uncomfortably as the familiar accusations swirled around me. Stage 2 breast cancer requiring aggressive treatment wasn't manufactured, but my family had decided that my diagnosis coinciding with Claire's engagement year was suspiciously convenient timing. "The venue Claire selected is absolutely perfect," my grandmother gushed. "The waiting list is normally 18 months, but her connections made it possible. That's what happens when you build real relationships instead of doctor shopping." Claire beamed while showing off her ring for the 20th time. "Jonathan's family knows the country club owner. It pays to associate with successful people rather than dwelling on imaginary problems." The dig was unmistakable. While Claire dated a successful businessman and planned elaborate weddings, I was supposedly inventing illnesses to compete for family attention. "Speaking of imaginary problems," my cousin Michelle said with false concern, "Rebecca, are you feeling better? You seem so fragile lately." Very dramatic timing with all these health scares during Claire's happy news. I touched my silk scarf, carefully positioned to hide the visible effects of chemotherapy. The hair loss, weight changes, and obvious port access were constantly explained away by my family as stress symptoms or attention-seeking modifications to my appearance. "I've been managing my treatment schedule," I said quietly, hoping to avoid another confrontation about my medical obsession. My mother's expression shifted to theatrical frustration. "Rebecca, enough. Stop pretending to be sick for attention. Claire is getting married, and we're not going to let your anxiety disorders ruin her celebration." The accusation hit like a physical blow. Pretending to be sick. As if stage 2 invasive ductal carcinoma could be fabricated for family drama. "Your sister deserves our focus and support," my father added sternly. "Not constant worry about your latest medical appointment or test result. It's time to grow up and stop competing with Claire's happiness." Claire reached over to squeeze my hand with practiced sympathy. "Becca, I understand you're struggling with my engagement, but creating health emergencies isn't the answer. Maybe you should talk to someone professional about these jealousy issues." The suggestion that my cancer treatment was actually therapy for engagement jealousy was particularly cruel. Every chemotherapy appointment had been reframed as psychological counseling, every oncology consultation dismissed as anxiety management. "I'm not jealous," I said weakly. "I'm genuinely happy for you, Claire. I've just been dealing with some serious health issues that require ongoing treatment." Michelle laughed dismissively. "Serious health issues? Rebecca, you look fine. A little tired maybe, but that's what happens when you spend all night researching symptoms online instead of getting proper sleep." My secure medical app buzzed with tomorrow's treatment reminder, but I didn't dare check it with my family already convinced that my phone represented hypochondriac research rather than legitimate medical coordination. As the family ordered dessert and continued planning Claire's bridal shower, I noticed a commotion near the restaurant entrance. A woman in a white coat was speaking urgently with the hostess, scanning the dining room with obvious concern. My heart sank as I recognized Dr. Elizabeth Warren, my oncologist, looking unusually flustered as she approached our private dining area. She'd been trying to reach me about concerning changes in my latest blood work, but I'd silenced my phone during Claire's celebration dinner. "Rebecca," Dr. Warren called out as she entered our dining space, her professional demeanor cutting through the festive atmosphere. "I apologize for interrupting your family gathering, but we need to discuss your recent test results immediately." The word doctor seemed to freeze the entire table. My family stared at this obviously medical professional, their celebratory conversations dying mid-sentence. "I'm Dr. Warren, Rebecca's oncologist," she continued, addressing the suddenly quiet group. "I've been trying to reach her about urgent changes in her treatment protocol that require immediate discussion." The word oncologist echoed across the stunned table like a bomb explosion. Claire's engagement ring suddenly seemed less significant as the reality of cancer treatment intruded on their celebration. My mother found her voice first, though it came out shaky and confused. "Oncologist? That means cancer doctors. Rebecca, what is this about?" Dr. Warren looked bewildered, glancing between me and my family's shocked expressions. "Has Rebecca not informed you about her breast cancer diagnosis? I specifically discussed the importance of family support during her treatment planning." The silence that followed was deafening. My father cleared his throat nervously. "Doctor, I think there's been some kind of misunderstanding. Rebecca has been claiming to have health problems, but we assumed she was exaggerating or seeking attention because of her sister's engagement." Dr. Warren's professional composure cracked with obvious disapproval. "Mr. Collins, your daughter has stage 2 breast cancer. She's been undergoing chemotherapy and radiation therapy for 5 months. This is not something that can be exaggerated or faked." Claire's hand flew to her mouth in shock. "Cancer? Actual cancer? But you never said, you just mentioned doctor appointments and feeling tired. Because every time I tried to explain how serious it was, you accused me of stealing attention from your engagement," I replied quietly. Dr. Warren pulled out her tablet, her expression growing more concerned as she processed my family's reaction. "Rebecca has been managing intensive treatment while apparently receiving no emotional support from her family. This level of isolation during cancer treatment is medically concerning." My Aunt Patricia spoke up weakly. "But she seemed fine at family events. Just a little withdrawn and tired. If it was really cancer, wouldn't she have looked sicker?" "She's looked exactly like a cancer patient undergoing treatment," Dr. Warren replied sharply. "The fatigue, weight changes, and obvious effects of chemotherapy should have been clear indicators that something serious was happening." Michelle found her voice, though it came out as barely a whisper. "We thought she was just stressed about Claire's wedding. Maybe having some kind of breakdown about being single while her sister got engaged." Dr. Warren's expression hardened with medical authority. "Your daughter has been fighting for her life while being accused of jealousy and attention-seeking. The psychological stress of managing cancer without family support could have seriously impacted her treatment outcomes." Dr. Warren cleared space among the dessert plates and wine glasses, setting up her tablet as if our celebration table had suddenly become a medical consultation room. "Since Rebecca's family seems unaware of her condition, I believe some education is necessary." She pulled up my diagnostic images, and suddenly the black and white scans of my chest appeared on her device for everyone to see. The tumor was clearly visible, a dark mass that even untrained eyes could identify as abnormal. "This is Rebecca's initial mammogram from 6 months ago," Dr. Warren announced to the stunned family. "Stage 2 invasive ductal carcinoma with lymph node involvement. The tumor measured 3.2 centimeters at diagnosis." My grandmother gasped audibly, her champagne glass forgotten as the visual reality of my illness filled the restaurant's private dining room. Dr. Warren swiped to show progression scans. "These images track her response to treatment over 5 months of chemotherapy and radiation. The tumor has shrunk by 80%, an exceptional response that speaks to Rebecca's courage and compliance with aggressive treatment protocols." She looked directly at my mother. "Mrs. Collins, your daughter has been receiving treatment every other week for 5 months. The side effects include severe fatigue, nausea, hair loss, and immune suppression. She's been enduring this while being accused of fabricating illness." My mother's face crumpled as the reality hit her. "We didn't know. She never said the word cancer. She just mentioned feeling unwell and having appointments. She never said the word cancer because you taught her that discussing her illness was selfish attention-seeking that detracted from Claire's happiness," Dr. Warren replied coldly. Claire finally found her voice, though it came out broken. "Oh my God, Rebecca. We really believed. I thought you were just jealous of my engagement. We had no idea you were actually fighting cancer." Dr. Warren pulled out additional documents. Furthermore, Rebecca's case has shown such remarkable response to treatment that we're presenting her outcomes at the International Breast Cancer Research Conference. Her courage in facing cancer while maintaining normal family participation is being studied by oncologists worldwide. She turned to address the entire family. While you've been planning weddings and accusing Rebecca of seeking attention, she's been achieving medical outcomes that will help other cancer patients. Her strength during treatment has been extraordinary. My father looked physically ill. Rebecca, why didn't you force us to understand? Why didn't you make us listen? Because I was trying to protect Claire's special year, I replied. Every time I mentioned feeling sick or having appointments, you said I was ruining family celebrations. So I learned to hide everything. Dr. Warren's expression remained professionally stern. Rebecca specifically requested that we not contact family members because she was afraid they would dismiss her cancer diagnosis as manipulation. In 30 years of oncology practice, I've never had a patient afraid to tell their family about having cancer. As Dr. Warren prepared to leave, the private dining room remained trapped in stunned silence. Claire's engagement celebration lay in ruins around the medical evidence of what they'd done to their daughter and sister. Rebecca's treatment will continue for 6 more weeks, Dr. Warren said, her voice cutting through the oppressive quiet. Her prognosis is excellent. We expect complete remission. But the emotional healing from facing cancer while being accused of lying will take much longer. She gathered her medical equipment while my family sat frozen among their celebration debris. I want you all to understand that your daughter and sister faced potential death while being told she was seeking attention. That level of strength and grace is medically remarkable. My mother reached toward me with tears streaming down her face. Sweetheart, we're so sorry. We had no idea. Please forgive us. I stood slowly, exhaustion weighing down my treatment-weakened body. You had the idea. You chose not to believe it. There's a difference. Claire looked devastated. Rebecca, I feel terrible. My engagement seems so trivial now compared to what you've been going through alone. Your engagement was never trivial, I said. But my cancer wasn't trivial either. You decided one mattered and the other didn't. Dr. Warren placed a supportive hand on my shoulder. Rebecca, shall I drive you home? Tomorrow's treatment will be intense and you need rest. As we walked toward the exit, my family remained seated among their shattered celebration, finally understanding that while they'd been planning parties and dismissing my health concerns, their family member had been achieving remarkable medical outcomes that would influence cancer treatment worldwide. The irony was complete. Claire's engagement dinner, designed to celebrate her happiness and success, became the moment everyone learned that the most extraordinary achievement at the table belonged to the sister they'd accused of jealousy and attention-seeking. They had wanted to focus on real accomplishments instead of manufactured drama, never realizing that surviving cancer with grace while being dismissed by family was the most significant accomplishment any of them would ever witness.